Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. A new study by researchers at the University of Bristol sheds some light on the prevalence of chronic fatigue syndrome, or CFS, in children and teens. Now, findings from the study, the largest to date of children in CFS, conclude that CFS is a common diagnosis for children and teens, with 2% of 16-year-olds having CFS lasting more than 6 months. Our guest in studio today is an expert in CFS and in fibromyalgia, Dr. Jacob Teitelbaum. He's here with us, director of the Practitioners Alliance Network, one of the most frequently quoted integrative medical authorities in the world. And he's also the author of the best-selling From Fatigue to Fantastic, Pain-Free 1-2-3, The Beat Sugar Addiction Now, and more. And he's here with us today to discuss CFS in children and teens. Good afternoon, Dr. Teitelbaum, and welcome back to Health Professional Radio.
Yeah, it's great to be with you again. And today we're going to teach people how to treat what really is a crippling and heartbreaking condition and how to treat it effectively, as well as how to recognize it.
You know, when we talk about chronic fatigue syndrome, normally we don't think of our kids or our teens having chronic fatigue syndrome. I mean, all they have to do is basically go to school and be a kid. It's usually us adults who are out here in the world and, you know, trying to make a living that suffer from chronic fatigue syndrome, just in what I've heard. Shed some light on this new University of Bristol study.
Well, in the study, they looked at over 5,700 children, and they found that about 2% of them had classic chronic fatigue syndrome. Now, that could be in the overt meeting the criteria, format. If you look at it, even more, probably on the order of 4%, have it in a moderate form. And these were kids who had it for at least 6 months. And when they looked at it, 3% of the children had it ongoing for 3 months at that time. Mm-hmm. It's a very, very common problem. And unfortunately, it's often just blown off as being the child being lazy or willful or growing pains or any of a host of other things, or most often we just say they're depressed.
You say it's often blown off as a child being lazy or uninterested. What has been the changing mindset? What happened?
Well, there now have been literally hundreds of studies showing that this condition is very, very different than depression. Mm-hmm. For example, in depression, you tend to have an elevated cortisol that's non-suppressible. In this illness, you have hypothalamic pituitary adrenal axis dysfunction, and the cortisol, although normal, tends to be on the low side. If you look at the immune changes, there are literally dozens of things. And the simplest way to distinguish, if you want to tell if the child is depressed versus ill, ask the child, do you have many interests? Are there things you'd like to be doing? And if the child goes, no, they're probably depressed. But if they say, I feel sick, there's hundreds of things I want to do and I don't have the energy, I'm too sick to do them, that child is not depressed. They are ill and they need to be treated for their illness.
Now, when you're talking about treating the illness, how different is the treatment for CFS as opposed to depression?
Oh, totally.
Let's talk
like
about
treating pneumonia versus cancer. And depression, we give antidepressants. You affect neurotransmitters directly and hope for improvement. In this illness, what they're having is an energy crisis at a cellular level. The body is spending more energy than it's able to make, and it essentially triggers a circuit breaker called the hypothalamus. Just like if you blow a fuse on a home and you have too many electrical things plugged in. So the treatment is to restore energy production with what we call the SHINE protocol. That means optimizing sleep. That's the S in SHINE. Mm-hmm. Because the hypothalamus, that circuit breaker that goes offline, Neal, is the sleep center. And when you have that not working, you can't get a good night's sleep, no matter how much time you spend in bed. And if you ask these kids, can you get a good night's sleep? They say, no, I have horrible insomnia. It's the same as in adults. So you've got to treat with sleep. Regular sleeping pills will usually make the problem worse, especially with the benzodiazepine ones, because they force people into light sleep. But in our books and the information I'm happy to send physicians, there are treatment tools we can send, questionnaires, treatment checklists, and the rest. Mm-hmm. But we go through which medications and which natural remedies are really more likely to help people get good, solid sleep. So optimizing sleep is step one.
Now, this study conducted at the University of Bristol in the United Kingdom, is there a difference in in how CFS is viewed in Europe as, in your experience, as opposed to here in the United States? Why was the study done in the UK, or is it just one of many studies that have been done around the world?
Sadly, it's similar to, if we go back about 150 years ago, multiple sclerosis used to be called hysterical paralysis. Rheumatoid arthritis, lupus were considered illnesses of neurotic women, basically, and then that changed. Although, God bless England, they're still, UK tends to be in the Middle Ages when it comes to treating CFS. They treat it like a psychological disorder, even though it's clearly not. And some of the researchers who do it, they say, oh, well, it's not, but then they try to make sure that people can't get any treatment. And there's been a pushback to really getting awareness of this illness. It's sad. One mother actually had a child taken from her and a child thrown in an insane asylum.
Wow. Because
she couldn't get help for her child. And it's really a tragedy that will change. But it's in UK, though, they're going through this process, and they're having to overcome that misconception, which they're going to look back and realize they've been torturing crippled people because those crippled people couldn't fight back. And even those crippled people are starting to fight back now.
Are there any other, you talked about asking a kid if they had any interest, and based on their answers, determining whether they, had CFS or whether or not they were depressed. Are there any other indicators, say missed school or things of that nature, that would indicate that a child has CFS as opposed to depression? Because we hear about depression constantly. CFS is something that we don't hear about so much and might not readily consider it.
Well, sometimes, Neal, we have that bad habit of saying, well, I don't know what's wrong with you, so you're crazy, to our patients. It's a really nasty thing to do. But we do it, and, we've all been guilty of that sometimes. But the funny thing is that even though there are a number of inventories, Beck is a classic one, many others, for assessing depression, studies have shown that as effective as all of the fancy indicators is to simply ask the person, ask the child, are you depressed? And if they say no, they're usually not. And if they say yes, they are. Kids are remarkably honest about these kind of things. And then, like I say, if you're not certain, just ask if you have any interest. But you can look at cortisol levels, you can look at other things. But simply asking that question has been shown to really separate out depression from illness.
Now, as we wrap up, what, in your opinion, would be the reason that the pediatric field, of all fields, wouldn't be more inclined to do the research and find out what's wrong with our kids, being pediatricians? Why is it, across the board, as far as specialties go, when it comes to kids who are viewed as being lazy or uninterested?
Well, the thing is, Neal, in medicine, we love to have a test that will distinguish what's going on. And there's no lack of tests that are abnormal in this illness, but there is no test that is only abnormal in this illness. So, diabetes, if the blood sugar's up, you got diabetes, period. And because of that, it makes it hard to do the research because it's hard to have the objective measures only for this illness. But what I will note for those treating this condition, two things. One, we have a tool called, it's a free energy analysis program. People can find it at www.endfatigue.com. The child and the parents can go ahead and take some quizzes, fill in their lab tests. It'll assess them to determine how to optimize their energy, basically what the underlying things are that need to be addressed. But for children, what's critical is to look for POTS, or orthostatic intolerance, postural orthostatic tachycardia syndrome. These things are very treatable. We're happy to send out, we have a Q&A on our website at endfatigue.com, and we're happy to send Mayo Clinic derived questionnaire that really is a good screening test for orthostatic intolerance. Other problems as well are more common in kids than in adults. But when you treat these, the kids get well. And we've treated many, thousands of adults and children with these illnesses. These are very treatable diseases. The problem is lack of physician awareness on how to effectively treat these problems.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. Jacob Teitelbaum, director of the Practitioners Alliance Network and one of the most frequently quoted integrative medical authorities in the world. He's also the author of the best-selling From Fatigued to Fantastic, Pain Free 123, and the Beat Sugar Addiction Now series. Also, the popular free smartphone app Cures A to Z. And we've been in studio discussing chronic fatigue syndrome in children and teens and some of the treatments, also some of the ways that the misdiagnoses of CFS in teens and adults occurs. It's been a pleasure talking with you, Dr. Teitelbaum.
Always a pleasure being on with you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.